Hello, my name is Dr. Michael Stefan. I'm the Medical Director of Beyond Beauty Plastic Surgery and Nip and Tuck Plastic Surgery in Miami, Florida. This is a short video for you to observe for post-operative instructions regarding the principal procedures we perform. Number 1 is a tummy tuck and liposuction 360. Number 2 is a BBL or Brazilian butt lift. And number 3 is a breast augmentation, breast lift, or breast reduction. So the one operation where we use an abdominal binder is an abdominoplasty or tummy tuck. The patient will wake up with a binder on. This white material is the binder. It's stretchy. It has a Velcro pad here to connect it to itself. The tightness of the binder should always allow for 2 fingers to be placed under the binder without difficulty. If it is too tight, it can hurt the underlying wound. An important point also is to always have dressings over the abdominoplasty incision, separating the binder from the incision. If the binder rubs on the incision, it can open and get irritated or infected. Now, all tummy tucks have 2 drains, one here and one here exiting the skin. The most common complaint or concern that we have among patients is the use of drains. The drain is removed on 7 to 10 days after surgery. And when the drain is removed, you'll see a white portion of the drain that completely comes out along with the drain. The drain is taken off of suction when removing, and the small suture holding the drain in place here and here is cut. Pull the drain out. It is not difficult. It may hurt, but it will come out without difficulty. So the important points about having a drain after surgery are the following. The drain stays in for 7 to 10 days after surgery. After approximately 6 to 7 days, the color of the fluid goes from red to a clear or straw color. When the drainage is less than 25 cc's in 24 hours, it is time for the drain to be removed. After the drain is removed at 7 to 10 days after surgery, the patient is taken out of the abdominal binder and placed in a faja. The faja also has an appropriate tension, allowing 2 fingers inside the faja to prevent excessive pressure on the healing skin underneath. The faja is wear for approximately 3 months after surgery, and as the swelling goes down in the post-operative period, the patient may find they go from an extra large to a medium-sized faja. The patient can also wear an abdominal board on the front of the abdomen for added pressure and contouring of the frontal abdomen, and in addition to that, foam boards that are placed on the lateral flank areas here and here. Those help contour the abdominal and flank areas after surgery. The garment is worn for approximately 90 days after surgery, and as stated, it may be necessary to go to a smaller size as you recover from the surgery. For example, the swelling will go down and therefore you'll have a smaller garment. For example, starting with an extra large, going to a large, going to a medium is the normal routine, and allows for the proper pressure of 2 fingers to be held within the garment for proper pressure. Today I'd like to make a few comments about BBLs, or Brazilian butt lifts. This is a procedure that is very common here at our practice. We perform a large volume of BBLs, and we have a protocol for the BBL patient that has stood the test of time and allows the patient to recover without any complications or problems. So with a BBL, the fat is harvested or taken with liposuction cannulas from the tummy, the flanks, and the back. This is referred to as liposuction 360 or 360 degrees. The fat is properly prepared and then re-injected into the buttock area here on the hips, the apex of the buttock, the lower buttocks, and the upper area of the buttocks. We suction here to create a nice contour going in on the lower back and then out onto the buttocks with a cuff at the thigh level. This garment is worn for 90 days after surgery. It is very important that no compression or pressure be placed on the buttock after BBL. So for that purpose, we have what is called a BBL pillow. The BBL pillow is a rectangular cushioned board. The BBL pillow is an important aspect of recovery from a BBL and should be used at all times. Okay, so an additional point regarding garments in the postoperative period. When you have to go to the bathroom, so for example, when you have to urinate, there's a small zipper here. Open the zipper and you use a urinal with the open zipper to urinate. When you have to have a bowel movement, you have to take the garment off and then put the garment back on after that. Hi, so here is an example of the postoperative brassiere or bra used after surgery. It has eyelets here which are to be connected, and it has a form-fitting bra with a strap around the back. The important point is for a breast augmentation, the incision frequently is here or around the nipple, and a 4x4 gauze should be applied over the incision at all times, because if the bra rubs on the incision, it can open the incision or cause a wound infection. For breast lifts with augmentation, we use an incision around the nipple and one under the breast, and the entire breast is covered with a gauze dressing to prevent inflammation of the wound. Additionally, after breast augmentation and breast lift, there's an upper pole bandeau which is used for the patient to use to keep the implants seated inferiorly or low in the chest wall position.